Good afternoon and welcome everybody. I'm so pleased you are joining us to celebrate Katie Nelson, our 2020 Emerging Leader Award winner. This year, in lieu of a live event, we'll take time for in-depth conversations with our alumni awardees to talk career journeys, why they're passionate about public health, and how they exemplify our school's value of making health a human right. My name is Heidi Mastrud, and I'm the Director of Alumni Relations at the School of Public Health. It's my privilege to work alongside our school's alumni. Their passion and commitment to improving health and well-being for people and populations all around the world are radically inspiring. Before Dean of the School, John Finnegan, and Katie dig into a rich conversation, there are just a few pieces of information I'd like to share. The University of Minnesota School of Public Health's experts bring clarity and scientific knowledge to a range of topics critical to understanding and managing the COVID-19 pandemic, the impact of racism on public health, and other issues of significance to the health and well-being of people and populations in Minnesota and far beyond. If you haven't taken time to explore recent research and news from SPH, I invite you to check out our website. Health in All Matters is a weekly podcast produced by the school to bring more understanding of public health challenges across the globe and close to home. We include expert voices from our faculty and their colleagues around the world. Our premiere series focused on COVID-19, and I'm thrilled to announce that the second series of Health in All Matters launched on October 15th and focuses on racism and the many implications this destructive force has on the health and well-being of Black Americans. You'll be able to find new episodes on our website or through your favorite podcast streaming service. If you find today's conversation interesting, I hope you'll join us to celebrate our next awardee, Christina Gertz, on November 12th. You're also invited to join us for a unique conversation with celebrity chef Carla Hall on November 10th. Carla will moderate a conversation with many of our own experts from SPH, as well as partners around the Twin Cities, to explore positive actions at the intersection of food, social inequities, and COVID-19. Register for these free events online. Finally, a few tips to begin. We'll have a few minutes for a Q&A with Katie at the end of our time together. You're welcome to submit questions at any time. Please type your questions into the Q&A box on your screen. We'll get to as many questions as possible at the end of our time together. We will be recording this webinar and encourage you to rewatch it or share it broadly after the event. Finally, I hope you'll take a moment to share a note of congratulations and celebration with Katie via Kudo board. I'm dropping the link into the chat box right now for you to access at any time. And now let's get to it. For 75 years, the University of Minnesota School of Public Health has prepared some of the most influential leaders in the field and transformed the way public health is practiced around the globe. Our programs and research have evolved to meet current public health needs, but our focus and determination to protect and promote the health of all populations hasn't wavered since the school was founded in 1944. Our school has trained more than 12,000 students since its founding. Our small group of awardees represents the determination, collaboration, vision, and creativity that are hallmarks of our school's rich history. The 2020 Alumni Awardees were nominated and selected by a committee of their peers as exemplars of the commitment, bold vision, and fortitude we need in public health. We're incredibly proud to call these alumni our own. Today, we celebrate the 2020 Emerging Leader Award. This award is given to an alum who's made a significant impact in her profession or community at large within 10 years of graduation. The emerging leader is a well-rounded and highly engaged professional who possesses integrity, credibility, and competence. Katie Nelson is this year's awardee. Katie is a freelance journalist, photographer, and filmmaker based in Nairobi, Kenya, and Minneapolis, Minnesota. Her reporting on human rights, global health, and accountability issues have been published by National Geographic, BBC, Al Jazeera, The Telegraph, Associated Press, Public Radio International, and more. She's a 2017 graduate of the MPH program in Community Health Promotion and was nominated by Dr. Tracy Toomey for the award. Katie, in recognition of all you have and have yet to accomplish in your career, we are so pleased to present you with the 2020 Emerging Leader Award. Hang tight while we cue up a video to introduce our audience to your work.
My name is Katie Nelson, and I'm a journalist, photographer, and filmmaker based out of Nairobi, Kenya. I graduated from the Community Health Promotion Program, which dealt a lot with how researchers and educators could help communities understand complex health issues. So my focus was on reproductive health, sexually transmitted infections, HIV, tuberculosis, and other highly infectious diseases. So I first came to Kenya when I was 21 as a volunteer for the Kenyan Red Cross, working in refugee camps and internally displaced people's camps on the western side of the country. And there I was meeting a lot of people who were facing severe health and medical issues and really had no opportunity or access to medical care or public health services. So at first I really thought I should go into public health because this is an issue that's solved in many ways for displaced people. You can get resources, you can get sanitation services to these people, and I felt like this is something that I can make an impact on. But as I started meeting refugees and IDPs, I started to realize that the thing that was most important to them was for me to tell their story. So people would oftentimes come to me for medical services and not really care. They would say, please just tell my story, because they believed that if somebody knew what was happening to them and the conflict that they were living in, that perhaps somebody would want to make a difference. And so that put a bug in my ear to write down people's stories and start documenting. I felt that I could use my public health degree to provide really knowledgeable expertise on global health issues while fusing it with journalism and storytelling, which has been a really good combination for me. So one of the stories that I'm most proud of in my journalism career is writing about Uganda's only radiotherapy machine, which broke down about 3 years ago and wasn't replaced for over a year. Hundreds, if not thousands of people were dying of treatable forms of cancer around Uganda and around the region because of this. I wrote a story for Al Jazeera highlighting the stories of 4 or 5 cancer patients who had treatable forms of cancer. Unfortunately, all 4 died in the time that I was covering the story, which was over a year. I think that this story did shame the government into getting a new machine. It was the only story that came out about it at the time, and the story from Al Jazeera then prompted a lot of other reporters to follow up on the program. And so I'm very, very proud because of my work. Uganda has a new radiation machine. In the future, I plan to continue using my public health degree to tell more and more stories about some of these stigmatized diseases and public health issues. My hope is that my work humanizes some of these stories and brings a face and a name to some of the most complex and difficult health issues that are going on around the globe.
Well, Katie, welcome and congratulations on your award. This is terrific, and that video certainly gave us an overview of what you've been doing since you left the U. But maybe we can ask you what your career trajectory has been, and ask you a little bit about what's happened. What are some of the biggest issues, biggest things that have happened to you since you left the U?
Well, first I want to thank you again for this award. It's quite an honor to be recognized by my peers and by the people who taught me so much at the University of Minnesota. So thank you for that. It's a great honor. Yeah, so I mean, much has happened since I graduated. I think, the world is kind of experiencing a lot of change, but for me, I left the University of Minnesota studying my thesis was about reproductive health within West African communities in Minnesota. So I always kind of had this interest in West and East African community health. And so I had initially gone to Kenya when I was 21. I turned 21 there actually, and had been going off and on since. But after I graduated from the University of Minnesota School of Public Health, I decided that that I wanted to go back into journalism and focus on global health issues, and I wanted to return to Nairobi, Kenya. So that's where I've been for the last several years. I have been covering a lot of issues regarding public health and global health in the region. So a lot of my work has focused on LGBT rights, human rights generally, sexual and reproductive health, HIV/AIDS, and other infectious diseases, as well as cancers and access to treatment and healthcare in East Africa. So a typical day for me in Nairobi, Kenya would be out reporting in some of the most challenging environments, but exciting environments. So I have spent a lot of time in brothels with LGBT sex workers. I've spent several months investigating lack of access to HIV treatment in Uganda. And I've followed pain and palliative care doctors throughout the region to understand what kind of issues some of the most vulnerable communities were facing in the region. So that's kind of what I've been up to for the last couple years.
Well, let me ask you, you know, some of the issues that you're dealing with are pretty controversial issues within the political framework of a country like Kenya. Do you get pushback from official sources? I can't imagine that this always shows the Kenyan government to be in a good light. How do you deal with that, and what has your experience been with it?
You know, I think I have had a lot of pushback with some of my investigations. So particularly in Uganda with, there's a radiation therapy machine that was treating cancer patients at the public hospital. And that had been—
Was that at Mulago Hospital?
Mulago, actually, yeah,
Yep.
Where the IDI staff is at the University of Minnesota. Yeah, so it's at Mulago in Kampala. And that machine had been down for about a year, and hundreds, if not thousands of people were dying of treatable forms of cancer. And I became so enraged after trying to call ministers in the Ministry of Health to ask questions, and nobody would answer my phone calls, and I would call day in and day out every cell phone number I could find. And finally, I showed up at the Ministry of Health, which is quite close to Mulago Hospital in Kampala. And I stood outside until somebody let me inside. And then I waited to basically talk to the ministers, and I waited there for 2 days, 8 hours each day, and they kept saying, their assistants kept saying they're not coming, they're in meetings. And finally one of them, I noticed them, came, and he actually thought I was a student, I guess because I look quite young, and he was like, yeah, I'll come talk to you. And then I ended up being able to interview him and ask him some really pointed questions about why there was no radiation therapy machine, and what this was doing to people. But yeah, and particularly in the day and age that we're living in, where fake news is a term that a lot of people use when I go out and report in the United States. I've been in the George Floyd demonstrations across the US, and Kenosha during the Jacob Blake shooting. It has become quite volatile as a journalist. So yeah, the stakes are quite high, but the payout and the accountability that I've been able to demand from governments is very much worth it.
So take us back a few years. When did the lightning bolt strike you that journalism was your calling, and combining it with public health?
Yeah, I think, you know, journalism, or at least writing and storytelling, had always kind of been something that I was interested in. At the University of Minnesota, I also got my BA in African Studies and worked at the Minnesota Daily. So I kind of always had this tie to journalism. But, you know, I was going back and forth between Kenya from the age of 21 to right now, which I'm 34. And, you know, I was always people always said to me, please just tell the world my story, which I thought was really poignant because, you know, in situations where there's conflict or displacement, I mean, people can really need a lot of things. And it was really clear that people believed that storytelling was worth it, that keeping people accountable and naming and shaming was important and impactful in the world. And so after I finished my MPH, I thought, well, I know global health, I know reproductive health, I know about HIV/AIDS and access to medical treatment. Why don't I fuse these two things together? Instead of kind of being the jack of all trades in terms of topics and coverage for news, why don't I do something that I know and love, which is global health coverage?
Mm-hmm. So when you are working on a story, this is a little technical detail from a recovering journalist, which would be me. When you figure out what that story is, how do you frame it and source it?
Yeah, Yeah, I think at the core of every story is a person, and it is a person's story. And so you really look for the most compelling and impactful story that you can find, or the person with the strongest kind of most all-encompassing voice. So, you know, with some of my investigations, they take months and months and months of like, you know, interviewing people, trying to find that one person that kind of says the whole story in a nutshell. Other times, you know, it's a lot more research heavy. So I'm working on a story about tear gas and the effects of tear gas right now. And there's a lot of academic research that I'm doing and talking to toxicology experts and stuff like that. But for the most part, you know, every story is driven by a human voice, at least the ones that I find to be the most meaningful. And so I really do look for that one person, even if it takes months.
Well, that's always intrigued me because you know, so much of what we do in public health is about the big picture, shall we say, the forest, and it, you know, it looks at the major issues. And the problem in communicating that sometimes to the public is that it's a little on the abstract side, especially when you see numbers and statistics and things of that kind. But it sounds like you're always looking for, yes, there's the larger problem, but you're looking for that compelling story that really brings it home to people.
Absolutely. And I think, you know, when we consider other places like East Africa very foreign, it's very easy to understand stories on a population level and really not care or not feel compelled to care, because it's just a group of people, it's thousands of people that are different and foreign and look different than me. But I think when you drill it down and you find the humanity in individual voices and are able to tell a huge story through the voice of, you know, one person, well, that can really spur a lot of change, as we saw with the story that I did in Uganda about the radiotherapy machine.
Mm-hmm. And for the benefit of our attendees today, there is a link to one of Katie's stories that she wrote for Al Jazeera. And that link is in the chat channel if you haven't had a chance to take a look at it. So let's talk a little bit about you know, how your work at the university and within the School of Public Health has shaped your direction here in journalism in combining these two things. What about that experience here has really helped to shape your career?
Well, I think, you know, journalists, as you know, are expected to know a lot about everything. And that has been problematic, I think, in the news sphere. And so what the University of Minnesota kind of equipped me with was a lot of knowledge and authoritative knowledge about infectious disease and reproductive health and HIV issues. So what we're seeing now with COVID is really it's a bit poignant in terms of the media sphere, because a lot of journalists are talking about COVID and are pulling a lot of information from press releases or synthesized information and not really drilling down into the academic research or even kind of the nitty-gritty day-to-day updates that vaccine makers are releasing. And so what you're getting is a lot of regurgitated summary news. And I find that very problematic in an issue like a pandemic where, news can be spread very quickly that's inaccurate. And so what I feel was really helpful at the University of Minnesota was that it gave me a knowledge base that was quite specific and quite rigorous. And so I feel like I can speak quite authoritatively about some of these issues of global health, reproductive health, Ebola, hemorrhagic diseases. Those kinds of things are issues that I really studied quite extensively at the University of Minnesota. It also allowed me to look at research really critically and read academic material in a way that I feel like I can ask questions, I can contact the researchers and speak to them on kind of the same academic knowledge basis. And that's been really helpful too, particularly recently with some of my work on chemical weapons and tear gas that has been used in Minneapolis. People really respect the MPH behind my name.
Mm-hmm. So the person who nominated you for this award and knows a lot about your background and your career was Professor Tracy Toomey in the Division of Epidemiology and Community Health. And before we go any further, I'm going to ask Sarah to run the video because Dr. Toomey wants to offer you congratulations.
Wonderful.
Hi, Katie. I want to congratulate you on receiving this award. I'm so proud of you. I remember when you were an MPH student and we would meet, and I so enjoyed our conversations then. And I've been so happy that we've been able to stay connected after you finish your MPH so I could learn about the very important work that you have been doing in Africa. I have to admit that when I've touched bases with you when you were in Africa, I was worried about you because the work that you're doing is so important, but I was scared because some of it is kind of dangerous work. And so when I heard you were coming home, I was relieved. I was like, oh, you're going to be safe. And then you started covering the protests, which is, again, such important work. But I would see the photos you posted of yourself in your PPE, and I was like, oh, this is also risky work. But again, so important. And so I just want you to know that I'm very proud of you. I think you're so deserving of the Emerging Leader Award. And I thank you for all that you do. And I just want you to stay safe. So congratulations again.
Very good. You know, it's interesting because I think folks in public health and folks in journalism tend to gravitate to where there's good trouble, as John Lewis used to say. And how do you deal? I mean, have you felt safe in the work that you've done? Occasionally you must have had a little bit of concern for yourself in your wanderings around Africa and other places, right here in Minneapolis.
Yeah, I mean, I think Tracy and my mom have a lot in common, and I so appreciate their thoughts on my safety because there have been some harrowing moments, more recently in Minneapolis than anything else. But yeah, of course, you know, in Kenya, I think what was tougher for me and what a lot of people who kind of visit areas that they're not from is that, like, people could vacation in Kenya, and it's one of the most beautiful places in the entire world. You have the sea, you have the mountains, you have the Serengeti. It's incredible. But long term, it was really stressful for me to, you know, continue to put myself out in these situations and, you know, find myself in environments that weren't necessarily always friendly to me. And that isn't to say that Kenyans aren't the most welcoming people in the world, but my work was inherently difficult. And so I think, you know, after 5 years of living in Nairobi and 12 years going off in and out of Kenya, it was wearing on me a bit. And I wanted to see the beauty of the country more than kind of what I was remembering, which was some of the hardships that I had seen there. But I think, you know, in terms of Kenya, I was so proud of the sources that I worked with and the people that I worked with who were risking their lives to talk to me every day. I mean, it just kind of paled in comparison to the uncomfortability and sometimes safety issues that I went through in Kenya because, you know, people were really, you know, talking to me and risking everything. I talked to Al-Shabaab fighters. I talked to people who were in hiding that were LGBT refugees, you know, and kudos to them for trusting me. I think, you know, in the United States, it has been the most harrowing, you know, experience reporting from here. I've been tear gassed at least a dozen times, quite severely. I was hit with, my car was hit with projectiles. My cinematographer was hit with a projectile, all from law enforcement officials who knew we were members of the press. So, you know, these things aren't siloed within East Africa or other parts of the world. Absolutely, you know, in the United States, some of the most atrocious abuses against the press have occurred right outside my door here in Minneapolis.
Yeah. No, that's true. Especially if you're a street journalist, if you're covering issues, tough issues like that, it doesn't make any difference where in the world you are. There's always going to be a bit of concern about safety and so forth. But you seem to have figured out a way to survive all that and to get your stories out and so on.
Yeah, I'm really lucky.
Tell me a little bit about being a freelance journalist. You know, a freelance journalist, when I was working in the analog world, was largely an excuse to lose a lot of extra weight because you weren't going to eat as much, right?
I'm sure my mom is laughing right now because she's always like, please eat when I came home. No, it is absolutely true. It's a good way to get more gray hair too.
Or lose it.
Yeah, exactly. Which I did both when I was in Kenya. So yeah, so being a freelance journalist is one of the hardest professions in the world. It's not like the old days kind of where people would send somebody to Congo and give them a retainer of $2,000 a month and they were just responsible for reporting the stories. I really have never gotten a forward on a piece before, so I pay everything out of pocket. If I believe in a story, I would front all the costs for flights, reporting time, transportation, and hope that I could recoup some of the costs at the end. And so, and that is true of so many freelance journalists, is that we're really struggling to continue telling these stories because we believe that East Africa has a story to tell. People in Kenya have a voice that should be heard. And so many times I would hear my friends saying, hey, do you want to buy my GoPro? I need to go do this story and I need some extra cash, or, you know, maybe doing a job on the side as a cafe barista or something like that, or doing newborn photography to, you know, front the cost of another investigative piece that would take several months. But freelance journalists are some of the bravest people in the world, and they do one of the most important jobs in the world. And so I'm very happy to be one of them.
Do you ever look forward if, for example, National Geographic or Al Jazeera were to say, Katie, how about a permanent retainer to cover in this area? Is that something you would hope for down the line in your career?
Well, I'm really lucky. I've actually been picked up by the New York Times to do some pretty steady work.
I've heard that's a pretty good outlet. Yeah.
Apparently so. They're well known, yeah. I guess.
Yes.
Yeah, so I guess you could say chaos follows me, or I follow chaos. But since I came home to Minneapolis from Kenya during the COVID-19 pandemic in mid-March, George Floyd was murdered about 15 blocks from my parents' house in late May. And I was out the next day on the streets reporting and was really lucky enough to meet an incredible cinematographer, Mike Shum, who kind of brought me into the loop at the New York Times. And I've been helping to produce a lot of the stories. So I was out the night that the 3rd Precinct burned down, which was an incredibly historical and very hairy night. And I've been reporting with them in Kenosha, and then I will be out with them for the elections as well. And then I'm also with the Wall Street Journal now.
Oh, okay. Wow, that's both ends of the political spectrum. So you're working on a documentary right now on COVID-19? Can you tell us a little bit about that?
Yeah, I'm partnering with Mike Shum. I'm an associate producer, and he's directing a documentary on COVID-19. So we're kind of looking at how the pandemic is affecting various characters throughout the country, I believe. And I hope I'm not telling any secrets here, Mike, that we have about 40 some characters across the nation and 23 cinematographers that we're supervising right now. And Mike is the big brains behind the whole thing. And I'm helping to coordinate it. And we're just looking to see what kind of decisions are people making in this pandemic and in this changing world of racial injustice and fake news, or whatever you'd like to coin it. How are people making the decisions and surviving throughout this? So it's a really exciting, you know, experience for me to be on a project like this with somebody so talented. But yeah, that's one of the projects I'm on right now.
Terrific. I'm just going to leave a quick note here for Sarah or for Heidi. I know that there are 2 questions in the Q&A channel, and unfortunately I cannot access that. So if you want to open those questions, I'll be happy to ask them, or perhaps you could ask them if you want to. In the meantime, while they're dealing with that, you know, let me ask the other question about, how did you get the international bug?
Oh gosh, I don't even remember. I think, you know, I've traveled a lot in my life. I've been really lucky. I traveled a lot in high school, and even when I was younger with my family. East Africa had always been a place that I'd found quintessentially different than my Midwestern growing up, my childhood, which is in a predominantly white area of Minneapolis. And I think I wanted to, when I was in college, go to what I could consider maybe the hardest or most difficult place or different place to where I had grown up. And so when I was 21, I became a volunteer with the Kenya Red Cross, and I flew into Nairobi and then took an 8-hour public bus to the border of Uganda and Kenya, and stayed there off and on for 3 or 4 years, working with rebel soldiers who were fighting a local conflict between the government. And so I would, at 21, like climb up these huge mountains physically sometimes because they were so isolated, to meet with these rebels and their families to deliver food and aid and medical supplies. And I just remember one time, I was meeting these rebels, and they told us to take off all of our cell phones, all of our radios, to drop everything on the table. I'm 21 years old, a little nervous. Everyone has AK-47s, and they put them all down on the table, and they're sitting there, and then suddenly, everyone was disarmed, and all the women and the children came out, and some of the kids were sick, and suddenly they needed help and medical assistance and stuff. And so that was kind of one of the shaping moments of my early 20s, and that kind of gave me the bug to stay in East Africa for a while.
Yeah, you're gaining a lot of very interesting experiences very quickly in your life. So, and we're glad that you're here to share them with us. I'm going to ask Heidi to jump in. We do have a couple questions that have been asked in the Q&A channel, and Heidi can let you know what those questions are, and we'll keep the conversation going along here. Heidi?
Yeah, absolutely. Katie, this is actually 2 parts to one question. Jacqueline says, although at this time consumers of news might feel as if there's nothing but bad news delivered, intellectually we know that there are more good things happening in the world than bad. Over the years, your work has included some good news stories. Personally, how important are the good news stories to you? And do these stories help keep you somewhat balanced and hopeful?
Yeah, so I think
great question.
That's a good question. I think there's a misconception, or perhaps I even believe this of myself for many, many years, was that journalists are cynics and journalists just want to tell bad stories. But I think the reality is that journalists like me are dreamers. We believe that the world can get better. And we just need to tell the stories that keep people accountable. But we also need to tell good stories, because the world can change because of those. And so yeah, some of the stories I've done have been incredibly inspiring. And one of them was, one of my favorite stories that I've done recently was about this bus driver in Kibera, which is one of the largest informal settlements in East Africa, or slums. And he every day would pick up 20, 30, 40 kids with disabilities who were in wheelchairs, whose mothers would otherwise have to carry them physically to school. And he'd pick them up in this kind of ramshackle public bus and carefully put them in, and put their seatbelts on and bring them to school, all for free. And he did this every day for so many years. And I was so kind of inspired and touched by his work that I started a fundraiser, and we raised $600, $700 for this guy who was just kind of making it on his last leg with this public bus. And we got him some gas and perhaps some, fixes on his bus. So yeah, those stories are really important to me. I think it is really important, though, to say that, there's only a very small group of journalists in East Africa to tell these stories. And so while the United States is very oversaturated with journalists, there are very few people who are really doing it on their own dime in East Africa to tell the stories. And so we do have to prioritize what's going on. And frankly, when there's thousands of people being displaced or there's a war, those stories not only are more important than some of the inspiring profiles that we go through, but that's also what readers want to read, and that's what editors want to buy. So it's kind of this give and take with those kinds of stories.
Yeah, and there's no end to the good stories that you can tell. I know in the many times that I've spent in Eastern Africa on USAID projects, you find people everywhere that are working in groups together to try to make the world a better place. They're part of that world. So there's still, even in some of the poorest areas that you find, there are people who are doing their absolute best to make the world a better place. And that's, I think, always hope, and it certainly counteracts the cynicism, which I think is an occupational health hazard for a lot of journalists. So I'm glad you've resisted that, Katie.
I'm trying. I'm sure trying.
So I got a question from Jessica Cole, and it's this: if you could cover one public health related story in the next year, what would it be?
Oh gosh.
There's so many.
You know, what I think is always interesting is how the United States, which is one of the biggest entities that gives donor funds around the world, how that is impacting people on the ground. So, for example, President Trump has cut a lot of aid towards organizations that provide reproductive health services to people in East Africa. And actually, one of my friends, Neha, just wrote a story about access to abortions in East Africa and reproductive health issues in light of President Trump's cuts. And I think, you know, looking at the ripple effect of a great giant like the United States, what those policy changes have on the ground in developing countries, especially when they're more restrictive, whether it's reproductive health or LGBTI rights or, you know, access to HIV treatments. All of these things are considered very taboo to some political entities in the United States. And so looking at these things and how they ripple effect across the globe is particularly interesting to me. I also think that racial injustice is a public health issue. And racism is a public health issue. And so obviously a lot of my work in the last couple months has been on that.
So it looks like, at least for the next year, you have a lot cut out for you, right?
I mean, 2020, we all have a lot cut out for us in 2020.
Absolutely, we do. We've got another question here. This is from Nathaniel Freeman. And he says, hi, Katie, congrats on your well-deserved award. It strikes me that the fake news phenomenon is itself a public health crisis. Has the increasing distrust of mainstream news sources affected your work? And do you see similarities or differences in the growth of misinformation in Eastern Africa and the US?
Absolutely. Ooh, hi, Nate. Nate is a lovely, lovely friend who I met in Kampala, who is an incredible lawyer, an attorney, and who now works in Minnesota. Absolutely. Like, you know, I think I've had to confront a lot of biases that we as the media have in the last couple months in Minneapolis. I have never worked in a more hostile situation when it comes to the treatment of the press than I have in the last few weeks and months.
Right here at home.
Absolutely. I absolutely feel like the Minneapolis Police Department and law enforcement were targeting the press, specifically the press. But I also felt like people who were demonstrating, you know, had been told that the news is fake, that they should be distrusted, whether it was people who were demonstrating who felt like they didn't want their face or their name out in public, to, you know, people who were more on the right who, you know, didn't believe that the news, you know, had any interest in their stories. I mean, absolutely. And, you know, these threats against the press, they kind of range from just people saying, you know, fake news, I'm not talking to you, to I've been, at one point, somebody tried to grab my camera and smash it, as well as my cinematographer during the demonstrations in Minneapolis, to, you know, being shot with projectiles like my cinematographer was. So yeah, absolutely. There is an incredibly heightened distrust, if not loathing, for the media that I've seen in the last few weeks and months here. In East Africa, yeah, I mean, it's kind of a different ballgame, because I think that there's a lot more open, or at least public, influences towards the media. And it seems like there's been a couple of stories I've done in Uganda of evangelical Christian groups from the United States going into Uganda and spreading hate-based rhetoric against the LGBT community. And they've, put those stories in the media. So at one point, and Nate will remember this, there was a newspaper called Red Pepper in Uganda that displayed a title or like a headline that said, like, kill the gays, or like, gays and homophobes are mixing and kill, like, find them all. They will remember this. But and literally there were witch hunts to find members of the LGBT community and hurt them or arrest them, or or worse. And so yeah, the media had a huge influence on a lot of these issues, and I'm just seeing that more and more, the polarization in East Africa and here as well.
So I'm going to close off here by asking you a question that you may have to ponder, but when you're thinking about your career trajectory over the next, let's say, 5 years, where do you see yourself?
I mean, I think that's the golden question, right? For so many people, like, what does this look like in my future? I think, tangibly, I'll be reporting on racial injustice issues, COVID, pandemic for the next couple months, and then see where I'm at after that. But I think, my hope, as I said, journalists are dreamers, and my hope is that I someday don't have to report about these things because they don't exist anymore. And racial injustice and inequities and inequalities in healthcare just are no longer a thing, and everyone is treated the same. So, my hope and my dream is to run myself out of a job and be able to retire peacefully and without the news ticker in my head.
I'm not a person who has a crystal ball, but I think, every generation makes a run at the issues that you're talking about here. And I know that journalism combined with global perspective and public health is a terrific combination, because it helps us be less isolated. It helps us understand both the commonality and the differences and the challenges that we have all over the planet. And I so admire you, Katie, because you have the verve, the energy, the commitment, and the training to step up for your generation and take a whack at these issues. And that means that generations down the line are building on the kind of work that you and so many other people are doing. So I really appreciate your willingness to take some time with us. I do see that there is one other question in the Q&A channel, and maybe I can ask Heidi to ask it.
Sure thing. One challenge for projects is how to leave something lasting after the international funds and support expire. What do you feel is the best way to develop projects which will survive when funds and resources from outside a community are no longer there? Your thoughts about that, Katie?
Sure, that's a great question. So I think sustainability, whether it's aid or even writing a story and then leaving afterwards, is really important. Obviously, community buy-in and working with people on the ground is really, really critical to the sustainability and longevity of a project. I also think that there are incredible people, in East Africa, in communities that already know the solutions to their issues and just need, a little bit of a catalyst, whether that's like a financial injection or, kind of some organizing, and then they can be left to their own devices. And so, there are so many capable people who are able to tell their own stories in East Africa and able to, help their own community. And so I think our role is to know when to step up and help, and when to step back from our privilege and let people take the steering wheel to their own lives.
Katie, thank you so much for spending time with us today. As I say, I just admire your energy and I admire your commitment to public health. We wish you all the best in your future career, and please stay well and safe. We need your voice. And with that, let me pass things back to Heidi.
Thanks, Dean Finnegan. Yeah, Katie, on behalf of the School of Public Health Alumni Society, let me just offer my heartiest congratulations one last time. Your dedication and passion for justice is inspiring to so many. From time to time, folks ask to honor our awardees by making a gift to support their priorities and interests at the school. Katie has identified that global learning experiences were foundational to her public health education and hopes that we can make that opportunity available to other students. If you'd like to make a donation to a fund that supports students' international learning experiences in public health in honor of Katie Nelson, please visit the link I'm going to pop in the chat box in just a moment. And Sarah, I wonder if you could pull up a slide that will show everybody how to connect with Katie and follow along with her work. She really encourages you to follow her on social media. And it's the next slide, Sarah. My apologies. We'll leave these links up for just a moment after the end of the event so you guys can make sure to get the information that you need. Thank you to all who have joined us today to celebrate Katie's award, and I hope we'll see you again soon. Have a wonderful day and stay safe and healthy.